Hello, Andrea from Chaz. Thanks for joining us. Shelly is here from Hillman. Hi, Carrie from Intercare. Dwight Hughes is here from Wayne Westland Schools near Detroit. We've got Motown in the house. Hi, Valerie from Grand Rapids. Rita's here from Golden Honor Community Health in Pontiac, Michigan, not too far from here. Hi, Stephanie from Alcona Health Center. Diana is joining us from Bangor, Michigan. Brittany is a CHW at Cass Family Clinic in Southwest Michigan. Hey, Karina joining us from Chaz. Always great to see you. Deliana's here from Chaz. We got Chaz in the house today. Kenyetta's here from Genesee Health Plan. Hello. Kareem is here. He is our program and grants manager at MiCHWA. If you haven't met Kareem yet, you'll be able to see him at the end of the webinar to say hello and goodbye. He's joining us from Sterling Heights. Tamia is here. Susan from Family Medical Center, Daniela. I'm trying to get you guys, they scroll by so fast. Amanda from Niles Community Health Center. Hello. Julie's joining us from Calumet. Diane Jansen at Cassopolis. Hello. Dara Harris is here. Hi, Dara. Valerie is here from Chaz. Kim J is here. Hello. Robin is here from Priority Health. Hi, Robin. Tia's here. Ivan, again, if I missed you, it's just because the chat's moving so fast. Our own operations manager, Neha, is joining us today. Always nice to see her. Shirley is joining us from Cass Family Clinic. And so without further ado, one more time, I will remind you, we will be sharing a link to take your webinar feedback survey to earn 1 CEU. We'll be sharing that in the chat and also sending a follow-up email with a link to take that as well. We are recording this webinar. If you lose connectivity, don't worry. We will send you a link to finish watching the webinar and you can take the webinar survey at a later time as well. I think we have everyone in the call. Okay, maybe not. And now without further ado, I would like to introduce our first special guest speaker. Her name is Janae Moore, and she is the Food Access Public Health Consultant joining us from the Michigan Department of Health and Human Services in their Physical Activity and Nutrition Unit. So without further ado, I will pass it over to Janae. Thank you so much for joining us today, Janae. How are you?
I'm well. How are you?
I'm
hope everyone's
great.
doing well and enjoying this beautiful day. Can you hear me? Just want to make sure.
Yes, ma'am.
Okay, thank you. And I also wanted to introduce Ashley Bradshaw, my colleague and co-leader in this work. She's on the call today. Can everyone see, can you see my screen? I think I shared it correctly, but I just want to check in.
Yes.
And we use Teams internally, so I always get a little like kerfluffled for a second when I have to use Zoom. So just making sure everything is working correctly. I wanted to start by saying thank you all for coming today to talk and hear about Fresh Food Connections. And just want to say, if you have any questions at any time, please stop and just ask your question. I can't see the chat though while I'm presenting, so if you could either answer your question vocally, or if Ashley or someone could stop me to let me know what the question is, I'd highly appreciate that, since I can't see the chat section. So without further ado, I'll start talking about the Fresh Food Connections program, which you might have heard as the Fresh Food Box program. We recently renamed it to Fresh Food Connections in order to really capture the holistic perspective of the food of the project that we're trying to complete, because you don't always get a formal box, and that seemed to be a little off-putting. So we wanted to provide a name that's more encompassing. And so the goal of the Fresh Food Connections program is really increasing fresh food access by connecting SNAP eligible communities directly to farmers. So let's see. There we go. And so it's actually a partnership between several organizations. So there's the Michigan Department of Health and Human Services, which I am a part of, and my colleague Ashley. We are the program oversight, programmatic leads, provide the vision and direction. We also are funding this project from a state-funded source and a federal funded source. We have Taste the Local Difference, which works on community relationship and development. They do a lot of marketing, social media, connectivity for farmers and food producers. You might have seen one of their like local regional food guides, which are excellent ways to understand what's coming about in locally sourced food. But they also, for this project in particular, they are definitely the bridge between us and the farmers, and they provide a lot of the community and implementation support. We have the pilot sites, which are the food business partnerships. So the farmers that we're working with in Detroit, the farmers that we're working with in Ypsilanti, we're now expanding to Ingham and Baraga County, and adding on new farmers to take the next step in the project, as well as community sites as we were trying to engage clinical and community spaces to help increase enrollees and participants in either SNAP programs or as participants in community supported agriculture. I almost did the thing we're not supposed to do, use a acronym, community supported agriculture, also known as CESA, and online shopping with local farmers. And then we partner with an external agency called Emergent Collective to do the program evaluation. And the project goals for the Fresh Food Connections are as follows. To increase access to healthy food. And that means physical access and purchase, but also education, utilization, and storage to for fresh food items. Laying the foundation for online SNAP sales. So as you may be aware, when we first proposed this project, this was prior to the pandemic. Online SNAP sales had yet to come to Michigan at all. It was still a federal pilot in a couple other states. During the pandemic, though, Michigan got the green light to become a part of that pilot, but very select stores. So it's Amazon, Walmart, I do believe Kroger may have come online recently, and Aldi's are a part of it. And so they can process your SNAP benefits online. However, our local farmers, local smaller stores and producers have not been included in that. We are trying to lay the foundation and create an infrastructure so that our state could be included in the next expansion to get our local food producers to be included in online SNAP sales, which is critical to the distribution and consumption of food. So on the eating edible side, but it's also critical to sustaining our local food system. I think a lot of us noticed how the shelves went bare pretty quickly during the height of the pandemic. That's because a lot of our food is shipped in, flown in, or driven in. And so, it really highlighted how critical it is for us to have a strong local food system.
I'm sorry, we can hear you.
Yeah, I was muted for a second. Sorry about that. I think we're set. Yeah, and so, we saw a lot of that. And even at that time, we actually had a lot of local farmers who had a surplus of food that they used to provide to restaurants. However, we still had no way to get it out to market. And so we're really trying to work on that part of the food system. Trying to create relationships and linkages between farmers, clinics, SNAP users, community members who live in SNAP eligible communities. And what that means is you may not receive SNAP benefits, but your area based on income level qualifies as a SNAP eligible community, and thus you are a part of being able to access those SNAP resources. And this is important for a couple of reasons. One of the things we wanted to accomplish with this project is to have long-term relationships built between farmers and purchasers. One, because we think that's critical to building a stronger food system, getting access to local fresh fruits and vegetables regularly for our residents, but also rebuilding the food system to support communities and be sustainable in communities and not always relying on big box stores or stores that, you know, might not be invested in the community to provide food to a community. Understanding that a lot of disease states today are, especially our unit is in the chronic disease division, are really diseases that are diet related, whether that be your diet can cause these increased complications or your diet can help actually heal you of a disease or help to manage your illness, right? And so it's important to include those people as they enter health clinic or clinical states in increased access to fresh and healthy foods. And then so we started the pilot trying to do participatory evaluation, really thinking about, one, what does evaluation look like on the farmer side? So understanding non-traditional models of evaluation, understanding that they don't have the same work schedule and timelines that we do. They're not in an office. They're, especially like right now, they are busy and booked in the fields working to make us great food. So understanding that. And then also from the community and participant perspective, what do they want us to know? And what do they need us to know? And what questions do they have for us? So trying to have evaluation that's more engaged and less top down, answer these questions so we can report without actually providing what the community or our participants need. So trying to move away from that model. And so how it works is that participating sites either set up a new website or update their website so that they can connect to an e-commerce system that allows them to sell food online. And there's different models for payment. So people can pay with SNAP, you can pay with credit, you can pay with cash or your various forms of payment. One of the things we don't do in this project is we don't supplement the cost of food. And there's a couple reasons for that. One being just simply the budget that we have does not provide for that. But the other part is understanding that supplementing the budget of food is not sustainable because those kind of grants they're not funded infinitely, right? And so what are the other kinds of systems like sliding scale models or SNAP or WIC that we can utilize to help people have more affordable food, but without supplementing the cost, because knowing that within a year or two, we would no longer be able to do that. The other reason why we don't supplement the cost is just because, or lower the cost, I should say, of food, is because food has value. So we also want our farmers and our workers and our food producers to also to be able to afford food. And so they need to get paid a livable wage for the work that they do, for the food that they produce. And so what are the models that helps us support that, whether it's like double up food bucks or again, helping them to get an online e-commerce that allows them to expand their consumer base. And so we help to fund the farmers to get the website, e-commerce site, marketing materials, implementing a food access program. Becoming a SNAP retailer is actually can be a long and complicated process. It also requires the purchase of equipment, so we help to support that. Phase 2, we work on relationship buildings. So getting new sites, strengthening old sites, and establishing referral pathways. So again, trying to work with community organizations or clinics or hospitals to help get new customers to the farmers, but also to help build relationship between the farmers and the customers. As I mentioned before, one of the things, I guess, could be the negative and the positive of this program is we want it to be invisible honestly, in a way. You shouldn't think of yourself like I enrolled in Fresh Food Connections. Fresh Food Connections should just work to connect you to food, but the actual relationship and the purchasing, there shouldn't be a distance between you and the farmer or you and the organization that you're working with. You should really and truly feel like you all have a co-beneficial relationship and are serving each other. And so for that, we also help with, we've worked to establish increased delivery options for our communities where, people cannot get to either drop off or pick up sites or a grocery store, working on storage materials, trying to increase staff time. So one of the things about SNAP is that because you have to process on site, someone from the farm has to be there and available in order to make sure those benefits are processed, since we do not have the fully processable SNAP online for local farmers as of yet. And so we're trying to help support that in. And then we are also trying to maintain the platforms that we have and increase community partners, and then also move into expansion. So getting the sites that we have to a maintenance stage so that we can move forward and expand into other sites in other regions throughout the state. And so where we're at, we have our Greater Lansing phase 1 sites now are in Ingham County and in Baraga, so Greater Lansing area, Western UP. We've been recruiting and onboarding new sites, new farmers, also trying to make relationships with new community organizations up there, up in Baraga, and tap into some of the organizations we already have relationships with in Ingham County. And understanding that not just serving the Lansing area properly, but what we're really trying to do as we expand into our new sites is increase our rural access and ability, understanding that in the first years, we started in urban areas. Phase 2 sites are still in Detroit and Ypsilanti. We're still working on community development. One of the setbacks of starting a brand new project and never before done program during COVID is that you have to think on your feet. And whereas we thought that we'd be able to have community organizations and reach out and pick up sites and community events, not so much during a pandemic. We had to really rethink on our feet and change the way we planned on doing our infrastructure. Now we're trying to, as the pandemic wanes, trying to get back out there and make those community connections that we plan to make. Increasing the referral sites, and then in-person drop-off and pickup sites, and also expanding infrastructure for those who would like to do delivery or finding community partners that can help them do delivery. Our participants in Detroit and Ypsilanti. In Ypsilanti, we have Ypsi Area Online Market, which has an online market infrastructure and an in-person farmers market as well. We have Old City Acres. And then in Detroit, we have Deeply Rooted Produce, City Commons, CSA, and Keep Going Detroit are all participating in Fresh Food Connections. And so here's a little information about each site in case you would like to refer someone or connect. I want to, before I go into detail about the sites, I would like to take a pause for questions. I've been talking for a second. Were there any questions as of yet?
There's none in the chat just now, Janae.
Okay, thank you. So the Ypsi Area Online Market is a year-round market from Thursday to Sunday, which has pickup. They have over 30 vendors with a wide range of products. As this is a physical activity and nutrition union project, of course, we are interested in people buying healthy food like fresh fruit, vegetables, lean protein, as well as whole grains. But the market offers a lot of different products, including cheeses and meats. So it's really a full service market for the community. They accept SNAP, EBT, or Bridge Card, depending on what you call it, Double Up Buck. They also have a prescription for health program and a WIC Project Fresh. Old City Acres is a more of a traditional year-round, flexible, community-supported agriculture farm. They have pickup locations in Ypsilanti, also in downtown Romulus. The farm is actually outside of that area, but they do serve the community. So we decided to keep them as a community-based farmer. They do bridge card or SNAP acceptance. They also do a supplemental low-cost share for students, understanding that students have restrictions on their income as well as restriction on their ability to often get to fresh fruits and vegetables. So in Detroit, we have deeply rooted produce. So that's they have a traditional community supported agriculture or CSA box, or a la carte purchasing. So you could either get a traditional box that's made up for you based on what comes out every week or 2 weeks. But we also understand that can be daunting for people, especially when you get something brand new that you don't know what to do. So they also have you can go online, pick what you want, purchase as you go. Their season is from July to October. And they have one pickup location, and they also do have a delivery, delivers on the east side of Detroit. And they accept SNAP, Double Up Food Bucks, WIC, and Senior Project Fresh. Detroit City Commons is like the last one. It has a CSA box or a la carte produce, a similar growing season. They have a lot more multiple day pickup sites across the city. So Palmer Park, Corktown, north end of Detroit, they go to the west side and the east side. So they definitely cover more ground with their shares. And they're also willing to deliver to a community site. So if you or a location, were interested in being a pickup site, you think that would serve your community well, they can be a delivery site and process payments there. We could work out a day for that. They offer 10 subsidized shares supported by other CSA customers. So that's one of those funding models that we talked about, other than just us subsidizing the cost of food, but using community subsidization as a way to do it, which is something we're also trying to advance for future, either through sliding scale models where an organization could create various costs based on income ranges, or they could work with the community or a donor to create subsidized shares. Keep Going Detroit, which offers, again, a CSA box and an a la carte produce. They open in April and close in October. And one of the things that's nice about Keep Going Detroit is all the produce grown is by Detroit, by urban farmers. So when we talk about really trying to strengthen and build our local food system, they're a perfect example. They also do a pickup site at Easter Market on Thursdays. They accept SNAP, Double Up Food Bucks, and they also offer payment plans for their CSA. So if you can't pay for the traditional whole share up front, which a whole share of CSA for a season can range, sometimes from $200 to $800, depending on how much produce you buy, how many shares you buy at a time. So they do offer payment plans for those who can't afford to pay the entire upfront cost of a CSA share. And so, really we're looking for people to engage, to get involved. One is to help impact chronic disease. I know you all are engaged in their work and supporting communities in various forms to do that. And so what we really want to do is, impact the diet-related disease states and impact overall health. I think we talk about health as in the chronic disease states, but we feel what we eat in many other ways, right? We know that our body feels better when we eat healthier food, whether or not we have chronic disease. And so what we really want to do is build the health of the communities that we serve and that we live in. And also improving health outcomes. We are working in SNAP eligible communities because those are also our communities that have some of the worst health outcomes. And what we're really trying to do is long-term is to build systems that would build long-term health and long-term community health. Also building community infrastructure and using it as an opportunity to attract new infrastructure, new investment, and new partnerships to these communities who need resources and support. Improving small farm viability, as I started at the beginning of the presentation, remembering what those shelves look like at the peak of COVID. Small farm viability is critical to long-term food access in the state of Michigan. I often tell people, I think when everyone thinks of like who's the greatest producers of food in the country, they often think of southern states, right? The number one producer of food in the country is California, and that makes a lot of sense, right? But the number two producer of food in the country is Michigan. And I think that is something that most Michiganders don't know and often miss, but we produce a lot of fresh fruits and vegetables, but most of it just leaves our state and actually doesn't get consumed by locals. And we could work on, there's real opportunity to, one, have more of it stay in state and have more of it consumed locally, but also because that drives down costs for farmers and that drives down costs for our residents. And at the end of the day, my job is to make healthy food affordable and accessible for Michigan residents. And then also strengthening social connections. As I said, the program at its best looks like no program at all. It's really about strengthening those local communities, those social connections between the farmers, their community partners, as well as the shopper. And so, in my dream state, this program would just run smoothly and no one would know I existed at Michigan Department of Health and Human Services. And so different ways to be a referral partner. You could direct food insecure contacts to the Fresh Food Connections website or to participating farms directly. You can explore the for partner section of the Fresh Food Connection website. I'd also reach out to Ashley or I to discuss if you have questions or if you were interested in, this would be great, but I work in a completely different area. Is there an opportunity for a site to come to us? We're definitely planning and looking forward to expansion in the future. You can request outreach and materials from us, marketing materials, just to learn more if you don't want to use the website. And if you need anything else, please feel free to ask. My email is, I believe, on the invitation, but if not, it's more as in money, OOREJ as in Janae, my first name. Oh, I went blank. Wait, nope. Yeah, J 44 at michigan.gov. Also, if you're at a clinic or a site, we would love to help expand our pickup sites for farmers or market to be directly at your location. We're really trying to get as close to the community as possible. I'm a strong believer in bringing the food to the people, not the people to the food, because that's what works best for the people. We able to cover infrastructure needs. If you're at a site, you think, okay, well, we don't have storage or we don't have a refrigerator or we need someone to be here to pick it up. Those are all things that we're willing to talk about and engage in and work out with different organizations. And you can also email Taste the Local Difference. You can email Kelly at localdifference.org. She is our direct contact over at Taste the Local Difference and who runs the day-to-day levels of the program. And are there any questions? Questions, comments, concerns, thoughts about the program, anything?
Janae, I see a question in the chat. I don't know if you were able to give some specific information about any programs located in Pontiac, Michigan.
So I'm going to stop sharing so I can see. So we don't have any programs currently in Pontiac, Michigan. There is Pontiac We Can. If you're familiar with Pontiac We Can, they can connect people to the programs that are in Pontiac, Michigan. But if you're interested or think this would be a good project for Pontiac, Michigan, if you think this would be a good fit, that is also something I would love to talk about if they think that's possible.
Okay, great. I'm going to put the website link for Healthy Pontiac We Can in the chat for anyone who is interested. Are there any programs in the city of Flint?
There are a ton of nutrition and food programs in Flint, especially since the water crisis. It kind of just depends on what population you serve. For children, there's a huge prescription for health program at Hurley Medical Center in Flint out of the farmers market. I can actually send some more resources, but there are a lot of food and nutrition access programs to the point where we've kind of been told to like not pop over there because they're a little oversaturated at the moment.
Okay, great. Are there any plans to expand the program to Benton Harbor?
Would love to. Please follow up. To be honest, we've been going at the pace of just funding and just having such a limited staff, but we've been trying. So when I first envisioned the program, one of the things I did was I have a list of like the 15 top 15 insecure food counties in our state. And trying to work through that list. That's our like priority list. Benton Harbor as a city falls on the priority list for high food insecurity. So if we can find the right partners and right farmers and work on funding, we'd love to work with partners in Benton Harbor. Sorry, I think you're on mute.
Okay, so next question, is Barrega the only site so far in the Western Upper Peninsula? There is a huge need up there.
So that will be it's our first site. We're building connection with farmers. There's a huge food hub and consolidation up there. So we're hoping to be able to expand. Like I said, it is our first site and it's our first pilot up there, but there is a huge need and we do understand that. And we're hoping as we be able to build infrastructure, we can expand across the UP. We've been in talk with various food partners up there to do so.
Okay, great. Next question. Will you partner with nonprofit food banks or churches?
Sure. Do you mean as pickup sites or in what capacity, I guess?
Let's see. Deborah Barksdale, are you still on the call? Janae would like to know, in what capacity are you referring to? Would you say partnership with nonprofit food banks or churches? Okay, well, if she pops on, then I wonder, are they able to unmute themselves? Let's see. We'll just go to the next comment, actually, is that Northeast Michigan is in dire need. So any plans in Northeast Michigan?
Yes. Sorry, I had to do the math. I'm not a spatial person. Yeah, I got there. Yeah, so like I said, we're following the food insecure counties list. And part of it is, so the program is currently funded by some state dollars. Some state dollars, but also SNAP Ed dollars. And so part of it is just securing more money so we can expand as much as we like. If we had, if we had a larger budget, we would have definitely expanded farther and faster, but some of it is just limited to our current funding. But we are trying our best to secure more funding for this project.
Okay, we did get a response to the question that we asked about the nonprofits and the churches. And her reply was pickup as well as drop off is what she's referring to.
Yeah, we definitely would. Originally, that's what we thought a lot of our sites would be. So we're definitely willing and would love to partner with churches and pantries.
Okay, great. Next, we have a comment that says Northeastern Michigan has Senior Project Fresh through NEMSCA. Are we familiar? Anyone familiar with that program? I'm going to Google it really quick. Okay, it looks like the Aging and Adult Services Agency of the Department of Health and Human Services has a program called Senior Project Fresh / Market Fresh. The Senior Project Fresh Market Fresh program is aimed at helping older adults eat healthier as they age. The program provides participants free nutrition counseling and $20 in coupons that can be exchanged for fresh fruits, vegetables, and other healthy foods sold at local farmers markets and roadside stands. Residents who are age 60 or older with a total household income of $22,000 or less for an individual or $30,000 for a couple are eligible to apply. Applicants must live in a county participating in the program, which runs from May 1st through October 31st of each year. If you think you are eligible and would like to participate, please locate an agency, and I'm going to share this link in the chat. Do you know anything
I'll
about
say
this program?
I do know about Senior Project Fresh, which is a great program to increase fresh fruits and vegetables access locally. But what I will, and it's during the growing season. So the reason why it's from May to October, because it has to be locally grown fruits and vegetables, and that's the Michigan growing season, more or less. But I would say the other thing that gets overlooked with seniors is that we have really high under enrollment in SNAP for seniors in Michigan, unfortunately. And so anyone who's working with seniors really working on or checking to see if they're SNAP eligible and enrolling them into the SNAP program, because our under enrollment is really high. And a lot more seniors would have food access if they were enrolled, but a lot of them don't know they're eligible for SNAP benefits.
Okay, great. Someone said thank you for replying to a previous question. And at this time, is there anyone else who would like to ask a question or enter a question in the chat?
Yes, what you had just mentioned about the seniors program, the under enrollment of that particular program. I was just curious, what do you think the cause is? Because I know you said there are like limitations or requirements that the seniors have to meet. Are seniors having more income now? Or, what do you think might be one of the problems that they're not enrolling?
In SNAP in particular, I just don't think they think of themselves as eligible. So I think the people associate SNAP particularly historically with like single mothers. Like that's kind of a consciousness thing of the history of SNAP or EBT and where it has been. And so I just don't think they think they're eligible unless someone has told them that there's a possibility. And because a lot of our seniors are on fixed incomes that meet SNAP requirements for seniors, they could actually get some benefits, but they just don't apply. So and when I've done, even just talking to people I know, done outreach about SNAP enrollment, usually the response is, I didn't know seniors could get SNAP. They're usually very surprised.
Okay, do they have any type of information that's out there that we could kind of help get the word out?
Sure, it's on the SNAP website, the MDHHS SNAP website. It has the requirements and the link to the application. It might also be a barrier now that the application is predominantly done online, so they may need assistance completing the application. But what's also nice about the online Common App is that it can also help you see if you are eligible for other services like heating or payments for bills or medical support. And so it really is covers a lot more supportive services than just finding out what your SNAP results might be.
Awesome. Okay, thank you.
All right, we have another comment in the chat that says, Prescription for Health sponsored My MSU Extension partnered with the local Mid-Michigan hospital. I believe classes are going on now. Weekly classes, the participants get coupons with money for fruit and veggies at local stores and markets. So for those of you who are familiar with Prescription for Health, they sponsored the MSU Extension with the local Mid-Michigan hospital. So if you're in that area, take a look at that. And then there is another question in the chat that asks, what is the difference from Bridge Card and SNAP?
So SNAP is the national name for what it used to be called food stamps. So supplemental nutrition access program. That's the acronym. Bridge card is essentially the nickname or the name we call it in Michigan because it has a bridge on the card, literally. That's why. And so that bridge, that picture is only on a Michigan card. Every state gets to pick their own image.
Okay, great. Any other questions or comments to add in the chat? Now is the time to ask Janae. Do you have any final comments, Janae, or anything you'd like to put in the chat as far as contact information? I did put your email in there a little bit earlier. I'm not sure if you have any other links or resources you'd like to add.
Let's see. I would like to just drop in the Fresh Food Connections link if I can pop back over for a sec. People can check out the website if they like. If there is a program that's already in your area, or maybe you want to check it out and then decide if you'd like to reach out to us because you think it would. Someone has a question for PEBT.
Yes.
Is there an income limit? There's no income limit on Fresh Food Connections. We don't, if it's in your community, then you're in a SNAP eligible community, and that's enough for us. And we don't ask for any income-based information. You just, like I said, we're invisible. You're just buying food. We're just facilitating the process. Parents inquiring, are they asking if they will be receiving pandemic EBT for the summer, or is that the question? Sorry, I'm looking at it. If they will still be getting it. It's month to month. So pandemic EBT has been approved, but I think it's getting approved by the governor month to month. So I can't guarantee whether they'll get the summer cards or whether it even be here in July. She's going on a month to month basis, but I do believe that that's the federal requirements as of right now, because the decisions are being made based on our COVID numbers. The numbers are going up. So that is a good sign for pandemic EBT, that the numbers are going up and not down, because that probably means that they will keep pandemic EBT benefits going as long as our numbers are on the rise.
Okay, great. Okay, so if that's everything, I'd like to say thank you from MiCHWA to Janae and Ashley for joining us today and sharing all of this helpful information. Thanks to all of our CHWs for joining us and asking all of these great questions. And now I'm going to pop the link for you to take your webinar survey to earn your 1 CEU for attendance at today's webinar. We're going to turn off this recording very shortly. And this should be available in the next couple of days on our YouTube channel. So if you have not yet gone over to the MiCHWA YouTube channel and subscribed, please do so that you can get updates. We don't post anything other than educational opportunities for you, so you don't have to worry about that. And we will also be sending out a follow-up email with this link in it as well once we get the final confirmation on the attendance lists. And we have some other information going through in the chat. So for those of you who would like to say goodbye, unmute yourselves or add something in the chat for Janae and Ashley, I'm sure they would appreciate that. I'd just like to thank everyone for attending, and I hope that you have a chance to enjoy the weather.